Our last section of the Sports Medicine 1 refresher deals with first aid and wound care. So as a couple quick reminders, in first aid we deal with what we call an emergency action plan. And that is a plan that is designed so in the event of an emergency, everybody already knows where to go, what to do, who has what job. Think about our fire drills. When we have fire drills at school, your teacher is in charge of taking your class to a specific location. And then at that location, there's other teachers that are there checking off to make sure that every room is accounted for. And is your teacher holding up a green sign or a red sign that shows that they have the people that are in their class? Everything is practiced well, and so that way when we have a real fire situation, everybody already knows what to do. And that's what we see with athletic related emergencies. So some of the things that we need to keep in mind when thinking about an emergency action plan is who is in charge of the emergency action plan. And that's going to depend on when the situation is going on, okay, and who is available. Because it's always going to be whoever has the most first aid and CPR training. Well, if that's in the middle of a Friday night football game, and we have our team physicians here and the EMTs already on site, they're going to be the ones in charge of that. If it's a regular practice day, and it's just your athletic trainers and your coaches, maybe a nurse in the school building, it's going to be us. It's going to be the athletic trainers that are in charge. So you can't say, oh, every single time it's going to be this particular person, because they might not be around. Other things that you need to remember: gates. Gates are locked. Who has the keys? Which gate are you going to have the paramedics, the EMT, the ambulance come into? How are you going to call? I don't have my cell phone, or it's dead, or there's no signal. Where's your nearest landline? Is that in a locked office? And then what happens when you are alone? Do you provide care first? Do you call first? Just different kind of things that you have to kind of have that planned out before that ever becomes an issue. So we're going to talk a refresher on CPR, and remember CPR stands for cardiopulmonary resuscitation. It's always going to be 30 compressions and 2 breaths. There is now the hands-only CPR where you don't do the breathing and you just do the compressions. That is better than nothing. But you guys are all first aid and CPR certified, so you are aware of the breathing component. The hands-only CPR is really for people who are kind of apprehensive on actually doing the breathing part, and they made that because they wouldn't give care because they were that nervous about putting their mouth on somebody else's mouth, which is understandable. Some changes that we see is if you're dealing with a child, you're going to use 2 to 3 fingers to press on their chest, or 1 small hand instead of doing your 2 hands for compressions. And then if you have somebody that is pregnant or obese, you want to make sure you're over the belly, okay, over the belly. Reminding you what our ABCs of first aid is. We see the A is dealing with the airway, where we are doing what we call the head tilt chin lift that we're going to see on the next slide to open the airway to see, is air getting in? If air's not getting in, is there something in the way? Are they choking, or have they choked to where they're not getting any air? The B component has our look, listen, and feel. We're looking for the chest to rise. We are listening to see if we can hear it, and our face is down towards their mouth, or do we feel that breath on our cheek? And then the C component is our pulse. Checking our carotid pulse for 10 seconds and trying to see if they have a heartbeat. So on the next slide, we have our pictures. This is showing you the head tilt chin lift. We're pressing down on their forehead, and we're opening up the jaw to allow that passageway to open. The last part over here is our carotid pulse. Remember, we hold it for 10 seconds. It's better to check at the carotid pulse than it is at the radial pulse in an event of an emergency. When we're dealing with somebody that is choking, we have two different categories. They are conscious and choking, meaning they are still responding to you, or unconscious, where you've seen them on the ground and you have to determine that they have choked on something. So a conscious choking victim, they're going to have the universal choking sign where they have their hands around their neck. They're going to be trying to cough. They could be red in the face. And this is where we do our back blows and abdominal thrust, or the Heimlich maneuver as everybody calls it. So the 5 back blows would be up against, you're going to have your arm across their chest, lean them forward and hit their hit their back, 5 back blows. And then your hands are already in position to move around and do the abdominal thrust right above their belly button, pushing in and up, in and up. Modifications for this, if they are pregnant, you want to be careful about thrusting around the stomach, that belly. Again, you want to do it above the belly. And then if you are alone and you're choking by yourself, using the back of a chair or a firm surface, and you actually have to do the upward and inward motion for yourself. You throw yourself on the back of the chair, which might be hard for some people to do. If you're dealing with an unconscious choking victim, they're not going to be making those loud coughing noises. You're going to see them just laying on the ground, and you have to determine through your ABCs that something could be in the way. So you're going to do 5 chest compressions just like you're doing CPR. You're going to open that airway with your head tilt, chin lift, and see if you can actually see any of the item that's causing that airway obstruction. If you can see it, you're going to actually do a finger sweep to get it out, but you're going to continue to do your chest compressions and look, chest compressions and look, and see if you can see that object. Our next section is about vital signs. Okay, remember there's different vital signs that help to indicate many different things about a person. The first vital sign that we're going to talk about is going to be blood pressure. And remember, every time our heart beats, the blood that is rushing out of our heart and to everywhere else in our body puts some pressure on our arteries. And so we see the 2 numbers. We see a top number and a bottom number. The first number, or the top number, is systolic. And that's, so like I said, the top number is your systolic number. And that's going to be the amount of pressure when your heart is contracting and actually having to push out the blood to everywhere else in your body. So it's going to be higher because there's more pressure when it's being pushed than when it's relaxing and your heart is refilling. And that is where the diastolic number comes in, or that bottom lower number. There's less pressure because your heart isn't pumping, it's refilling the blood. Okay, your blood pressure can tell you a lot about a person. High blood pressure can often mean that there is maybe some damage going on. Heart could be not beating like it should be beating. There's just kind of like a big indication. So some changes that can occur, if you're on medication, it can either decrease or increase your blood pressure. And that could be any medication. It doesn't have to be blood pressure specific medication. Stress, the more stressed you are, naturally your blood pressure goes up. And physical fitness status, the more fit you are, the lower your blood pressure usually is because your heart's more efficient. And then activity level, while you're working out and your heart's having to work harder, it could go up. But if you do more relaxing activities, it would go down. Okay, so there's lots of things that play a role in your blood pressure. The next one is your heart rate, and that refers to the number of times that your heart's going to beat in 1 minute. Usually it's in a 60 to 80 beats per minute at rest. And so when we start doing our labs and our activities, it's not going to be in that range. It's going to be higher depending on how hard you're working. And we see our carotid pulse and our radial pulse are going to be where we are going to check our heart rate. Things that can affect heart rate are going to be very similar to the things that change our blood pressure, because our blood pressure is directly related to our heart rate. The next category that we see is referring to our breathing rate. Okay, and that's going to be how many times you breathe in a minute. The average person at rest is going to be 12 to 20 breaths per minute. How many times does my chest rise? The more we are exercising, the more air that we need to take in, so the more that number goes up. The more efficient we are with our exercising. It means, if we ran 1 mile every single day for a year, at the end of that year, it would not be as hard as it was at the beginning of the year. And so your body wouldn't need to work as hard to do that same activity. So we wouldn't have to have as many breaths as we did originally. And so again, the breathing rate is going to also be a good sign to see what's going on with the person. Next we see body temperature. 98.6 is our normal body temperature. If we have an increase in body temperature, it could mean something like heat exhaustion, or it could mean that they have some type of infection, bacteria that they're trying to fight off. Remember, a core temperature is going to be way more accurate than an oral temperature. I know oral temperatures are a whole lot easier to manage, or like we use the ear a lot in our training room. But just kind of keep in mind that a core temperature is the only one that's going to be the most accurate. The next section is going to be referring to the different skin colors that we see that can indicate some different conditions. We have the bright red, which most time in our field is going to mean heat stroke. We also can see that with people who have carbon monoxide poisoning, which thankfully was not something we dealt with in athletics. Yellowing of the skin means jaundice, that they have something going on with their liver. And blue is lack of oxygen, and pale is lack of circulation. They could be going into shock. If they're losing blood somewhere, there's not going to be blood in their face or other areas. Now, last part is wound care. And wound care, big things to remember is we are trying to clean the area. We're trying to stop the bleeding. We want to properly bandage things. And in our field, in athletics, that means two different things. And this is what our practicals is going to be over. The quick, fast, I need to stop the bleeding quickly and get that athlete back on the field. Or I have my half time and plenty of time to clean the wound out, make sure it's properly dressed. And so you have to kind of make that decision. What supplies do you absolutely need, and what's going to be effective? If they're going to be running and you're taping an area that's near a joint and it's constantly flexing and extending, how are you going to get that to stay? How creative do you have to be? We also want to make sure that we do not compromise their circulation. So doing our capillary refill and seeing that they still have good circulation after you've applied your dressing. And of course, a fractured area. If you suspect that there's a fracture, we don't want to move the area, but we want to try to stabilize the joint that is below and above. So if I have a forearm fracture, I need to stabilize my wrist and my elbow to make sure that I have decreased the amount of movement in those bones. So we're going to talk in class about our practical information, and we're going to go ahead and get this underway.